Oh no, completely forgot about my appointment. I need to reschedule. The hospital aren't answering my call.
I have been on the waiting list for over a year. I'm not well and I can't travel. Taking 2 trains and a bus to get to hospital is too much for me.
I can't take another day off work to take my daughter to hospital. She is well anyway.
They don't listen anyway. What's the point going for 5 minutes to appointment and don't get answers to my questions?
We've lost £5,000 this week because of wasted appointments. Our waiting list is going up. We need to fix this.
Hello, my name is Aisha Bourawi. I'm an honorary consultant in adolescent and young adult rheumatology at UCLH. Over a period of 9 months, as QLab Test team, funded by the Health Foundation, we used the power of data and coproduction to understand and address barriers getting in the way of young people accessing care. In this project, we focused on clinical attendance.
Hi, my name is Professor Debjit Sen. I'm a rheumatologist at University College London Hospital. As you may know, not attending appointments is a big problem for the NHS and certainly for our hospital at UCLH. In order to understand this problem a bit better, rather than take an approach where we tell our young people what they should be doing, we decided to take a new approach. We wanted to listen to them and work with them. We asked them to help us solve this problem. We took a varied approach using 2 things. The first thing we used was data, a quantitative approach, and the second thing we used is something called a qualitative approach, where we listen to individuals with one-to-one interviews and through group work. What the data showed us is that there are 2 major influences of young people not being able to attend their appointments. Firstly, the distance from the hospital, which may not be surprising. But secondly, what some of us found surprising was that something called the index of multiple deprivation, which is a marker of socio-economic status, or in simple terms, poverty, was the second major association with hospital non-attendance.
We enhanced our outpatient clinical attendance prediction model to help us proactively identify and support patients at risk of clinical attendance because of inequality. Using the iceberg model, we gathered qualitative data to deep dive into aspects of health inequality that get most in the way of young people accessing care. We interviewed young people not attending clinic and organized engagement events, hangout space.
After a few months of co-planning and side sign with healthcare professionals, young people co-delivered Hangout Space Workshop at UCLH. The event included patients, interns, and other interested young people, as well as healthcare professionals. The event was co-facilitated by the young participants. It featured interactive sessions in the morning, aiming to understand barriers and facilitators to wellness in young people, and what get in the way of accessing care when needed.
Hi, everyone. Harry. Lunchtime.
Yes, lunchtime.
For an exercise. It's going to be role play, where we will have our young people who are now, you're now official clinician. Well, unofficial. In this space, we're official. There will be little cards, 2 different bags, and the ones who are commissioning in outside world. In this room, you are now a young person who is accessing healthcare with a long-term illness. And so there's different challenges and you have to somehow articulate what you feel you are the young person in that role. And for those of us who are young people doing 10 minutes, how would you conduct it, you and a professional? Well, you are the professional. So how are you going to conduct that appointment or that scenario?
In the afternoon, we use creative art activities and reverse simulation, which was insightful and fun and helped to create a sense of community and connection.
She surprised me. I deliberately after her. Yeah, that's something I would take away and think about. And I was really annoyed with my GP when she was just reading the script of, and you should nutrition and you should drink well and eat well and go to bed at a specific time. And if you can't sleep, read the book and go back or something that's although there be the script, but yes. So yes, I think my rule was like. So I think it's good to do it as part of our training.
It is so uplifting and helpful to feel heard, valued, and respected as equal partner. Young people and healthcare professionals felt that reverse simulation is an innovative training approach to support staff develop skills and knowledge to care for young people holistically.
Independent thematic analysis identified communication, travel, stigma, and compelling priorities between health and education as the main drivers of clinical attendance. Together with young people, we framed the problem and co-designed tools to support teams with the resources they need to proactively support their patients. We introduced the role of peer support coordinator in our pathway and built a peer support environment by setting up a weekly hangout space delivered for, with, and by young people to help them develop the knowledge, skills, and confidence to manage their own health. We invested in prevention and worked closely with our community partners. And over the last 3 months, we engaged with 5 local schools, delivered several workshops with 90 students. 30 of them joined our project as quality improvement partners. Our quality improvement community partners co-designed surveys and creatively identified ideas how to support their peers to stay well and to fundamentally improve the way we deliver care by investing more in wellness and prevention.
It has been such a wonderful morning. I am so excited about this project and what it's going to bring for our learners. An outstanding department should be doing what we are about to embark on. There should be interface between education and all other institutions that play a fundamental role in young people's life.
This success couldn't be achieved without the wonderful team who worked very hard over the last year behind the scene. Most importantly, young people who were part of this project.
It was so amazing to hear the views of all the students. I think it's such a special opportunity for everyone involved to work together and make real change that will have a long-lasting impact. I feel so excited about what could happen in the future.
It's been a joy. It's been remarkable to be a part of the Pathway to Equity project. There's so many fantastic things that I've personally got out of it. And they're trying to do some of the most difficult things in healthcare in terms of addressing inequalities for our young people. But the way they've gone about it sets the project apart. What they've done in partnership with the young people in devising and delivering the research, in coming up with the ideas for service delivery has been extraordinary. So many brilliant ideas from spaces in school for people to work, from really amazing peer support elements, from complex data-driven analysis of why patients and young people don't turn up, all has come together in a fantastic way. But I think the most striking thing for me personally is just to sit there with those young people who've been doing this amazing work and just listen to them about the way they see our services, to listen to them tell me about the things that they care about, to tell me they don't have the bus fare to get to the hospital, has been really eye-opening for me personally, and I can't wait to see where this project is going to go next.
Health inequality is damaging. It's time for us to break down silos, engage meaningfully with the people we serve, and fundamentally transform the way we deliver care. We invite you to join us on this journey of hope, to save the lives and futures of our children and future generations.